Hello, thanks for listening to the Total Knee Tips and Pearls podcast. This is Adam Rosen, your host. I'm a fellowship-trained orthopedic surgeon who specializes in joint replacement. In these episodes, I'm going to share with you a lot of my tips and tricks and review classic articles and current implant designs. Thanks for tuning in, and on with the show. Welcome back. You're listening to the Total Knee Tips and Pearls podcast, and I'm Adam Rosen. Today, I'm actually going to give you a twofer. Instead of breaking it into two different talks, we're going to talk about osteonecrosis and two of the most common classifications, the one by Ficat and the one by Steinberg at University of Pennsylvania. And I think it's important to kind of know both because the people that you may be talking to may use one versus the other. They're quite similar, but they do have a few little nuances. A little caveat, definitely if you're going to do a talk and a lecture on any particular topic, know your stuff, because I'll never forget when I was in training in Philadelphia and somebody came to lecture about hips and they were talking about osteonecrosis and they went into detail about the classification by Steinberg. Unfortunately, they didn't nail the description of the classification, and Dr. Steinberg happened to be sitting in the audience, so he was able to stand up at the end of the lecture and correct the young gentleman. So, definitely know your stuff when you're getting up at the podium, because you never know who might be listening. So when we talk about the Ficat classification, this was originally described, back in the 70s, in France, and he went on to have a second classification, and then pretty much what we're familiar with is this modified Ficat classification, and this was published in the Journal of Bone and Joint Surgery, the British edition, in 1985. And what he did state is there's two fundamental concepts that he had when it comes to talking about osteonecrosis in the hip. Number one, he said that standard X-rays show the shadow of mineralized portions of the bone. And number two, that bone necrosis is the end result of severe and prolonged ischemia. And not to go into too much detail, but they went into a lot of the options that were really available to them at that time for making diagnosis, one of which was bone scan, but a lot of invasive ways of actually measuring bone marrow pressure, measuring the oxygen saturation, or testing the intramedullary venography of the bone itself, and even doing core biopsy. So, obviously we have other ways of diagnosing that nowadays with the advent of MRI, but they were doing that with the data and the skills and ability and techniques that they had available at the time. So when we talk about the modified classification, stage 0 was one of these things that was added to the original stages. So stage 0 is a preclinical and a pre-radiographic finding. It's basically a suspected diagnosis, most commonly if somebody has diagnosed osteonecrosis on the contralateral hip. And they termed this the, quote, silent hip, end quote. So that was stage 0, is preclinical, pre-radiographic, suspected diagnosis in the silent hip. So Ficat stage 1, the most common symptom is this sudden onset of pain localized to the groin. Patients will complain of radiation into their thigh, pain that typically is worse at night. They'll have limited range of motion, but the X-ray is still normal. So stage 1, symptoms, no X-ray findings. Then stage 2 is where you'll start to see some sclerosis in the femoral head and cysts on X-ray. Stage 3 is the classic Crescent sign. So this is the appearance of a sequestrum on the X-ray. This is a subchondral fracture with some segmental flattening. These patients will have increased pain, decreased range of motion, and potentially a limp. And stage 4, which was the last stage that Ficat described, is osteoarthritis with a deformed head. They also noted that the majority of cases they saw were due to osteonecrosis, and this was seen 50% of the time. So again, Ficat stage 0 is preclinical, the silent hip, normal X-rays. Stage 1, again, normal X-rays, but symptoms, pain in the groin, limited range of motion. Stage 2 is where you'll start to see sclerosis in the femoral head and cysts. Stage 3 is the classic Crescent sign. And stage 4 is osteoarthritis with the deformed head. Now, Steinberg first described this back in the 80s out of University of Pennsylvania. I'm referring mostly, I think, probably the best description from my standpoint is the article that was published in JBJS, the British Journal, in 1995. So they went on to describe the 6 stages and basically the types and findings on Xray. But they also quantified this with regards to the actual sizing. So they were able to, give, in addition to just an Xray finding, they were actually able to quantify the size or the volume of the changes seen as well. So in stage 0, this is Steinberg's classification. Stage 0, this is normal. Normal X-rays, normal MRI, normal bone scan. Stage 1, X-rays are still normal, but with the advent of MRI, we can find MRI is positive, or prior to MRI, or if a bone scan was used, bone scan's positive. So you may see a cold lesion on the bone scan, or this serpiginous style change that you'll see on the MRI. And what they did is they started classifying these into mild, moderate, and severe. So a mild case was less than 15% involvement of the head. A moderate case was involvement of 15 to 30% of the head. A severe case was greater than 30% of the head. Stage 2. Stage 2, X-ray now is positive. And just like in the Ficat, stage 2, you see sclerosis and cysts. Stage 3, Steinberg, is that classic crescent sign with collapse of the head, but this is subchondral collapse. So this is the collapse of the head below the actual articular surface, so you don't see flattening yet, where stage 4 is flattening. So it's that sequestrum of the dead bone underneath. The head is yet to have collapsed to a stage 3, but stage 4, that transition now on X-ray, you see the actual flattening of the head. And this is where I think he added a little bit more where, with Ficat, they just describe it as osteoarthritis and deformed head. Stage 5, Steinberg, we're talking, the joint is narrowed, but the acetabulum is not involved. And stage 6 is the advanced arthritis. So, going back again, so stage 0, normal X-rays, normal bone scan, normal MRI. Stage 1, the X-rays themselves are normal, but now you start to see this most commonly nowadays on MRI. Stage 2 is the cystic and sclerotic changes in the femoral head. Stage 3 is the subchondral collapse producing the crescent sign. Stage 4 is when the head now flattens. Stage 5 is joint space is narrowed, but there's no acetabular involvement. And stage 6 is advanced arthritis. And again, when you quantify this, we're talking about quantifying the changes seen. This is anywhere from stage 1 up to stage 5. We're going to talk about changes in the head are less than 15%. This is mild. Moderate is 15 to 30% head involvement. And severe is greater than 30% involvement. So there you have it. Ficat classification of osteonecrosis, Steinberg, University of Pennsylvania classification of osteonecrosis of the hip. Check both of these articles out. Good things to have in your armamentarium, and just knowing the similarities and differences. So you can be well-spoken when you're up at the podium, but you can have a good understanding and conversation when you're seeing these patients and making these diagnoses. So thanks again for listening. I'm Adam Rosen. You've been listening to the Total Knee Tips and Pearls podcast. Until next time, stay safe. You've been listening to the Total Knee Tips and Pearls podcast. Make sure that you're subscribed so you'll be notified of future episodes. And please take the time to leave a review. It helps other people like you find the show. Until next time, stay safe.